I wan discuss briefly how to take do wetin we dey call breast self-exam. First thing wey you go do na to stand front of mirror. When you stand front of mirror without your clothes on, you dey look your breast. Here you dey appreciate the size of your breast and the shape of your breast, and you dey compare the right and the left. This one will help you see if any deformity don dey happen for your breast, around the skin, or the entire breast itself. Hello my people, and now welcome to another episode. Today we wan yarn about one important topic wey concern many men and many women. The topic today na breast cancer. So as October na breast cancer awareness month, this na good time for us to talk about wetin breast cancer be, wetin be the things wey fit dey make person to get am, and how person fit do to take prevent am, and why e dey very important for you to catch am early. No matter where you dey, whether na for Naija or diaspora, e dey important say this matter concern all of us. So make we start. First, today I wan start with wetin be breast cancer. Simply put, breast cancer na when cells for inside your breast begin dey grow anyhow. Sometimes e dey form lump, or sometimes e dey form tumor. E dey happen well for women, as I've been talking earlier, but men fit also get breast cancer, although e no common like e dey very common for women. And we get different types of breast cancer, but the common types na two, which is the ductal carcinoma and the lobular carcinoma. The ductal carcinoma na when e start from the ducts wey dey carry milk dey go the nipple, and the lobular carcinoma na when e start from the glands wey dey produce the milk. Breast cancer fit spread go other parts of your body if you no detect am early, and na why e good make we understand wetin fit cause am and how we go fit take prevent am. So wetin fit cause breast cancer? When we talk about certain things wey fit cause breast cancer, because generally we no really understand wetin dey cause cancer by itself, but we understand say e get certain things wey dey increase person risks. And as for breast cancer, e get some things wey we fit control wey dey cause am, and e get some things wey we no fit control. Let we start with things wey we no fit change. For number one, we talk about age. As person dey old, your risk to get breast cancer naturally dey increase, especially women wey don pass 50 years. Number two, family history. If your mama or sister don get breast cancer before, it means say you get a higher risk to have breast cancer. Number three, genetics. E get some people wey get some gene mutation for wetin we dey call BRCA1 gene and BRCA2 gene. So if you get that kind of mutation, you get increased risk well. Then we'll talk about menstrual history. E get some women wey start their period very early, before they reach 12 years. And e get some women wey enter menopause late, after 55 years. All these people, their risk dey high small. Then let's enter things wey we fit change for breast cancer. One, lifestyle, like your exercise habit, your activity levels. If you no dey active, your risk don naturally dey increased. Then we'll talk about smoking. Tobacco has a very high content of what we call carcinogens. These are things wey fit promote the growth of cancer. So smoking is a very high risk factor. Another thing na alcohol intake. People wey dey drink alcohol, the more you drink, the more your risk to get breast cancer. Another thing na weight and obesity. Person wey don fat well, wey dey add more and more weight, especially after menopause, you get very high chance, okay, your risk fit don increase because higher estrogen levels, and this one fit help some kind of breast cancer to actually grow. Another thing, now we already talked on before, exercise. If you do not exercise, you dey increase your risk of having different types of cancer. We also need to check things like hormone replacement therapy, and some people wey dey take birth control. Some people dey take hormone replacement for menopause just to help with their symptoms like hot flashes and things like that. And also people dey take birth control to take prevent pregnancy or for other reasons. So these are things wey fit increase your risk small. So you need to talk with your doctor very well to know wetin go fit work for you, whether you need am or not. Now, how we fit take prevent breast cancer? The good news be say, you fit actually do some things on your own to take reduce your risk of having breast cancer. Here are some of the ways. Number one, maintain a healthy weight. Make sure say your weight stay okay, especially after menopause. When you chop better food, we get plenty fruits, vegetables, we get whole grains and lean proteins. These are things we fit, promote overall well-being, overall good health. Exercise, make you dey exercise regularly. Try to do at least 30 minutes of exercise most days of the week. I would recommend 3 days a week, okay? Because overall, as you do the exercise, you go see say you go boost your immune system. It will help you maintain good weight, and it will just improve your hormones well. Then limit alcohol and avoid smoking. If you dey drink, may you no pass one small drink a day. And if you dey smoke, consider may you quit. Okay, because it not only help reduce your risk of cancer, it will also improve your overall health. Then another thing we will consider na breastfeeding. For women we feed breastfeed, it help you to reduce breast cancer, especially if you breastfed for at least 1 year or more. Now, if you dey use hormone replacement, but it's good make you dey very, very careful. Like I said, work with your doctor. Make them make sure say that the lowest dose, the safest dose now you dey use, and now for just short period of time. Prevention when it comes to breast cancer, it better pass cure. And these lifestyle changes, they fit go a long way to protect your health. Now, it is important when we talk about one of the most important things for breast cancer. The reason for this whole awareness, which is early detection. If person fit catch am early, the treatments could get better results, and person fit survive. Survival rates could be very high. How we fit take identify am early? Number one is called the self-breast exam. So they check your breast by yourself regularly. This one fit help you just make you just know how your breast supposed to be. And if you notice something we know they normal, like long nipple discharge, any change in the size or shape of your breast, no ignore them. Sharp go see doctor. So now I want to discuss briefly how to do what they call breast self-exam. First thing what you could do now to stand front of mirror. When you stand front of mirror without your clothes on, you then look your breast. Here you they appreciate the size of your breast and the shape of your breast, and you they compare the right and the left. This one will help you see if any deformity don't they happen for your breast around the skin or the entire breast itself. The next thing what you want to do now to raise your hand up. So you go raise your hand right and left. Here you still they check for changes in the breast, because it gets some kind of mass way now until you raise your hand. Now we will feel appreciate them well. So when you lift your hand once again, you will look the breast, check for any deformity, any changes in the shape or any abnormality there. And the next thing you want to do now, say you go come feel your breast. Feeling this breast is very important, and you go use the pulp of this your 3 fingers, these pads of your fingers, and you go touch the breast. So when you lift your hands up, if you want to feel the left breast, you will lift up the left hand and use your right hand, the right palm, and you feel the breast. There are different ways you can feel it. You can either do it in a circular motion, or you can do it up, down, either from outside in or inside out. But the plan I say make you feel the entire breast. So now I want you to take note, say when you feel your breast, places where you feel stay, feel your breast. When you bath, inside the bathroom, as you don't pour water for body, you feel rub small soap for your hand. As it is slippery, it go dey easy for you to examine the breast. Also, when you come out of bathroom, you feel examine, and when you lie down, so you feel lie down for bed, put small pillow behind your neck, lift up one hand and examine, lift up the other hand and examine the other breast as well. You can do it standing while in the shower, or you can do it when you're even sitting down or laying down on the bed. You can support your neck with pillow. I hope so with this small description you will take go house, learn how to examine your breast by yourself. We don't recommend make you examine this your breast once every month, and preferably right after your period, so that the breast no will be too tender. The next item what I want to talk about as part of early detection is something called a clinical breast exam and mammogram. You don't examine your breast by yourself. It's important for you to go and see an expert, either a physician or a nurse, to help you and examine your breast clinically, so that they can identify or clarify if there's any masses or any lump or any problem with your breast. Mammogram is by far one of the best ways to detect early breast cancer. Even before person begin dey notice any changes. Generally, women between the ages of 14 and 49, talk to your doctor first. Or if you're younger than this age group and you have a higher risk, then you and your doctor fit decide say whether you go do mammogram or not. Women wey dey between 50 to 74 years, it is important that you get a mammogram done at least once every year or every 2 years. Get a mammogram done. This will help us to identify any early changes, any suspicious lesions in your breast, even years before it becomes cancer. Now, if you get family history or genetic risk, as I been don talk before, your doctor fit recommend to make you start to do the test much earlier than when you turn 40. Sometimes, especially for women wey young or we get dense breast tissue, doctor fit recommend ultrasound or MRI join the mammogram wey you dey do. Because early detection, e no just dey save life, e fit even help us to determine which kind treatment wey we go give you, wey no go dey too hard and wey go give all of us overall best results. So as of today, wetin we fit do to help ourselves reduce our risk for breast cancer and to detect am early? First, make you book an appointment with your clinician for a clinical breast exam or a mammogram if you never do one recently. Another thing wey you fit do na try add healthy habits for your life, like chop better food, chop healthy food, exercise and reduce alcohol. People wey dey smoke, stop to smoke. Educate yourself, because at this stage of our lives, ignorance is not an excuse. Because if you get phone and you fit buy data, you are able to read and educate yourself. No be every time you go social media na comedy dey. I know say wahala plenty and you need to laugh, but you need to educate yourself as well. Share this information with your family and community. Together, make we try raise awareness to help people live better life. For my immigrant people wey dey diaspora, I know say sometimes it fit hard for you to find health care when you dey far from home. But make you make use of the health services for where you dey, like emergency services. Ask questions, because early actions will actually save life and make all the difference. Thank you, my people, for joining me today for this special episode of Dr. Amas. Breast cancer awareness no be only to sabi, na to take action and protect yourself and your loved ones. If you like this episode today, make you like am more, subscribe and share am with people wey fit benefit, your friends, your family, your co-workers. Remember, your health dey your hand o, and take action today, make you live healthier tomorrow. Till we go yarn again, abeg stay safe and healthy. Una bye bye o.